Welcome everybody to Two-Spirit and Miracle of Love National Transgender HIV Awareness Panel. I am Renee Coto-Lewis with Two-Spirit Health, Affiliate Relations Coordinator. And please see Ken if you have not gotten your drink ticket. I would also like to tell you just a little bit about Two-Spirit Health and Miracle of Love. Two-Spirit Health is a center of excellence. We offer clinical services for the LGBTQ community and regardless of insurance. Also, we have Miracle of Love, who provides HIV care, education, peer support. Check them out, go to their website and support them. So, on our panel today, we have, and as we go down, just raise your hand as I just mention your name so everyone knows who you are. We have Dr. Baker Hargrove. He is the CEO and co-founder and president of Two-Spirit Health Services. We have Angela. Angela is one of our volunteers with the outreach team at Two-Spirit Health Services. We also have Roberto Katz here. He is one of our counselors and therapists over at Two-Spirit in Behavioral Health. Then we have Giselle. Miss Giselle also just recently won Miss International Queen and was honored by the city of Orlando. We also have one of our medical providers here, Miss Crescinda Wu. And we have a great supporter from the community, Nadia. So first we're going to start with some questions that were already pre-selected, and then we're going to move on to some questions that the audience went ahead and provided for us. The first question we're going to ask for everyone is, why is National Transgender HIV Awareness Day important to you? David.
Hi, I was going to say, I'm Dr. David Baker Hargrove. That makes me feel like I'm a contestant in the pageant. I'm your contestant number one. I am the co-CEO of Two-Spirit Health Services. All pronouns are welcome. I am non-binary. So I think it's important to me because of the fact that we tend to think, especially what I've noticed over the years in this community, that HIV and people who are at risk for HIV tend to be relegated to people who identify in the gay male community. And the reality is so much more broad. There are so many more members of our community that are potentially at risk for HIV, and I don't think the education and the awareness gets out to those members.
And I'm Angela. And to add to that, it is today that we can focus on testing, treatment, and prevention within our community.
I'm Roberto, contestant number 3, vote 3 please. Well, in general terms, we're talking about what most of the community, the wider community, is not willing to talk about. We cannot remain silent. There's a very strong stigma about HIV. There's a very strong stigma still about LGBT and our transgender community. So I think that this is important. This is an opportunity for us to give support and to end the silence.
Thank you. The question is, why is this day important? This day is important because, first of all, LGBT rights were started, riots and marches were started by trans women. And with that being said, this day is very important for us because we need the attention to educate, not the LGBT community, but we need the attention to educate the community, the world. Right now, we a lot of times we focus on the LGBT, but that's not what we need to focus on. I believe trans women, we're family members. We're your cousins, we're your sisters, we're your brothers, we're your uncles, we're your aunts, we're your mothers, we're your fathers. And I think it's our job as trans individuals to educate our allies and heterosexuals on the importance of PrEP and PEP, and knowing that they need it just as well as we do. So I think that's why this day is very important.
Thank you, thank you.
Yes.
I agree in totality on that one, but I also want to know everybody to know that I'm here for education, okay? Like she said, it's not just a one-site problem, it's everybody's problem. So we need to make education basically paramount and basically teach everybody how to be safe, okay? It's not just one particular community, it's everybody in totality, and that's what it is. We have to basically educate everybody, and that's what we're here for. That's what I'm here for, educate you. What medications you need, how you need to be safe, okay? Because nobody's gonna have stops having sex, so we might as well learn how to do it safely, right?
Well, I was just gonna say I agree, because I think also that it affects the world, not just a certain group of people. I think it's something that affects everybody, and not everybody's willing to talk about it. So that's why I agree.
What would you like the people in the community to know about HIV?
I think two things that are very important. One is that the medications that are used today to treat HIV the advancements have been so amazingly terrific. The toxicity is low, and that the ability for the medications to do their job without causing a lot of cellular damage and organ damage long term is amazing from where we've come from 20 years ago. When the original medications were, you prayed for death just being on the medications. They were so awful. And I think that's very important, that that HIV is manageable, it's treatable, and it's very possible to live a normal lifespan now. Taking care of yourself a little bit. Obviously diet and exercise, not smoking, but to live a long normal life. But also is that PrEP is such an important tool for us to protect our community and to get to zero transmissions. I tell people all the time, if there was a pill that you could take once a day to protect you from getting cancer, everyone would be taking it. And why isn't everyone taking PrEP?
And what on earth can I add to that? HIV is not a death sentence anymore. You can live a normal life, a normal, happy life. You don't have to be afraid anymore because you're infected. There's still a lot of stigma. That's the way people are. But you have to embrace yourself. It's something that you have to deal with. So you have to embrace it, stay true to your regimen, be compliant, and just live a normal life. Be happy. Don't let it stop you from living. You can't do that.
So in lies to what it has been said already, the doors for prevention and for treatment are fully open. It's just a matter of making a choice. You have the choice to cross this door, you have the choice to seek for prevention, you have the choice to seek for treatment. Unfortunately, one of the biggest barriers for people to cross that door is the matter of the stigma. So if you want to continue contributing to the problem, continue with the stigma. If you want to be part of the solution, then be supportive and encourage people to cross the door. And more importantly, you're the main advocate for your health. Encourage yourself to cross the door.
I agree with everything everyone said. I think, like you said, erasing the stigma is very important. And education. It's about education, letting people know the facts about HIV, knowing that you can live a long, healthy life if you are in treatment. I think one of the things that we need to do now is start educating our youth more and more. Because what happens is now you have very young individuals that get on Grindr and Jack, and they meet these individuals that know that they are positive and they're not in treatment, and they will purposely, try to transmit this disease to someone else. So I think if we go to the youth and we educate them and say, look, I know you're going to be young and dumb and you're going to do different things. But if you get this one pill and you take this one pill a day, it doesn't matter what these people that purposely come at you and try to infect you, little will they know you're protected already. If you take this, there's a lot of different topics, a lot of different angles we could come at when it comes to HIV, but like I said, it has to start with the youth, because we're adults, so if we're going to stop it, we have to start with the younger people and let them know you can protect yourself from this. Because when I was 16 years old, I was meeting guys that was much older than me and doing things with them, and they weren't going to tell me their status or not. And we didn't have PrEP and PEP, then. So I think with HIV is erasing the stigma, educating the youth, letting them know that they have options when it comes to this disease, and just continuing to educate our allies as well, because our allies are mothers and fathers, so they can teach their children. They won't be afraid to tell their children, hey, if you're having sex, then we need to get you on PrEP and PEP, so that's what I feel about it.
I agree with all that. What I love about some of these medications now is that, like David had said, that they used to cause a lot of liver damage and a bunch of other things that went along with it. Now they make a little pill that even the homeless man that lives under the bridge can take it and not have to worry about any side effects, okay? We're getting to undetectable levels so we don't pass it to our partners, okay? That's what we're talking about. We're talking about prevention. We're talking about educating the community and teaching them how to be safer with their... We're not telling you to stop having sex. We're telling you how to do it properly, okay? And take the preparations that you need in order to be safer when you're having sex, okay? So we're making people more aware of what they need to do. And I want to give a shout out to Gilead, because they're not even making any other medications right now, because you know what? After this, it's going to be a cure.
I do agree with everybody that it is important for everybody that this is a medicine that everybody needs to take. It is really simple. I feel like it's important to know that HIV isn't something that's, I feel like from an ignorant point of view, you get nervous when you don't know about the situation. But like for me and my personal experience, one person that I really, 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 really love, like my whole life, that it was my grandma, and I didn't know that she had it until I was like 12 or 13. Wow. And I mean, just eating after her, that being my grandma, we're always around each other, we're always together, and I didn't know she had it. And when she told me, it was just like I don't know, it was just normal to me. It didn't become something that was like scary to me, because I knew that she was living a normal life. If she didn't tell me, I would never have known anything like that. So I do think it's important that it's just something you take care of. If you don't have it, there's something to prevent you from getting it. If you do have it, it's something to keep you living a longer life. So, yeah.
So this is another question for everyone. What would you like our trans community to know about PrEP?
I think that it's an important tool to use in preventing the spread of HIV, and if you are not HIV positive, then it's the best way to protect yourself from getting HIV positive. But I think that also that part of that is really working through the stigma. In our society we stigmatize everything having to do with sexuality, and that's why there are still transmissions today, because we're not talking about it. We have to talk about it. How did the LGBTQ community get any measure of equality? We came out. you know, and so I think that, you know, for, as people with HIV, we have to come out and be more bold in talking about our status and what it means to be HIV in today's world. You know, for so many years, that was something that I would never even imagine being able to say to somebody. And, but I realized that the only way we're going to eradicate the stigma is that we have to talk about it. And those of us in the positive community have to be willing to talk about it and share our story.
You know, I've come to realize that trans women are the highest affected by this disease. It's the highest percentage of infection. And, you know, I'm going to be honest with you. I know a lot of trans women, but I have a lot of trans women friends. And they have to be sex workers, you know? And they're not informed. They don't have the information. They're not educated. They have no clue. They have no clue. I think that a lot of those girls who know about PrEP now, they'd be into spirit. But they just don't know. And that's where our outreach is so important. We have to go out. We have to let them know. They don't have to be frightened. Honey, if you're not infected, come get tested, get on PrEP. If you are, come get some help. You know, but you have to make them understand that because it's available. It is here. Help is right here, and they just don't know. It is so sad, but I promise you, I'm going to do all I can.
It's just that I really cannot add more to what's been said. Very often, even though we have plenty of information out there about prevention, about options, for some reason we are not able to reach people. There's something missing in translation because the propaganda is there, the information is there, the option is there. It is a well-known part of the menu of options. However, for some reason, as much as we present it, it's not getting here. It's not getting to the heart of the people. It's not touching the emotion. So I don't know what can we do to make PrEP also touch people and prevention touch people, and get to the heart of people, to the heart of the matter. But I just want to ratify what has been said. It's part of your menu of options, and if you think that you're at high risk, that's a great option. That's a great layer of protection in your life.
Well, it's kind of hard to add on to what everyone else said. I think that what we're going to have to start doing is we're going to have to start having conversations, and we're going to have to start letting people know that we relate to them. I think a lot of times we have people that are HIV negative that walk around and they have risky sex because in their minds they think they're positive because of the risky behavior that they have done, and they're really HIV negative, but they're afraid to go get checked. And so I think we have to start talking to people and saying, yeah, I've gotten on here and I went to Parliament House and I've done this and done this, and so they can say, well, yeah, I have too. We got to start relating to people and letting them know that I'm human too, and I've done the same things as you to try to erase that fear, because it's all about fear. That's all it is. People just are afraid of what's going to happen after they become diagnosed, or they're afraid to just get those test results. And some people, like I said, some people walk around and they're not HIV positive, and they don't get tested out of fear, and they continue to have the risky behavior, and what they do is they become positive because they continue that behavior. But if we can get those individuals to come in, erase that fear, get them to come in, get tested, get them in PrEP, then they will remain negative. And I personally, I work at Bliss Healthcare Services, and we also provide medical care regardless of your ability to pay. And what I have learned in my almost 2 years being there is test and treat is very effective. If you get someone that comes in and they test reactive and you start them on treatment that day, most times they're going to stay in treatment. If you get someone that comes in and they test non-reactive, and you get them on PrEP that day, and they see, oh, the pill didn't really do nothing to me, it didn't do anything to me, most times they'll stay on treatment. You know, but that's why we have to continue to all the agencies, Miracle of Love, Two Spirits, Bliss, at the center, everybody, we have to really push, test, and treat. And we also, at Bliss, we also offer Urosure. Because a lot of times people will come in and they'll get PrEP and they don't take PrEP the way it is prescribed. And then if they come up positive, then they say, oh, it didn't work, or they want to blame the doctor, or they want to blame, and it's no. See, Urosure, what they do is we take a urine sample and we're able to monitor the amount of PrEP that is in your system, so we can see if you are compliant, and we can see if you're taking the medicine the way that you're supposed to take it. So we gotta start taking responsibility for our community, for our world. And like I said, once again, it's not just LGBT. I feel like this, I feel like married women are some of the most people that need to be educated on PrEP and PEP. Especially people that have been in long-term relationships and long-term marriages. Your husband steps out, your wife steps out. It happens. And a lot of times women are brought back things, or men are brought back things. So women need to know that they have these options. Men need to know that they have these options. Men that are attracted to trans women need to know that, you know, trans women are have a higher rate of having STDs in general. And they need to know that, okay, if I'm going to mess around, let me protect myself. Let me take PrEP. So if I am going to be on the down low, if I am going to like trans women undercover and be irresponsible and not use a condom, I have this protection to protect me, and that'll keep our world from contracting the disease, because I think the disease is spread by people that aren't true to themselves. You know, people that don't live in their truth, and they hide behind these wool masks, and they do things, and they think, okay, well, I just had unprotected sex with this person, so if I took a shower, so it's over with. This thing is done. No, you know, it only takes one time. I know I could go on and on, but just I wanted to get that all up. Thank you.
That aside, the thing that I think is most important is that we've gotten to an age where we really do need to do more testing. I mean, if you ask just a general person on the street when the last time they had an STD test, they'll tell you sometimes it's like, well, I haven't had one in over a year, or it's been 2 years, or whatever the case may be. We need to, what I try to teach basically is anytime, every 3 months, if you're sexually active, if you're switching a partner, you're not sure about your partner, let's face it, in these times, nobody's fully disclosing all of their sexual behaviors. That's just not going to happen, I'm sorry. But, so you do a disjustice to yourself by not putting yourself on PrEP, and then maybe having promiscuous sex, and who cares if you do or you don't? I don't give a crap. What I care about is, do you come in to get tested? Do you get yourself on medications? That's what I care about. I don't care if you do Joe, Jim, Sheila, whatever. I don't care. But come in and get tested, okay? That's the most important thing. I don't care what your promiscuity is. I don't care if you're monogamous. Just get yourself tested. Do your due diligence, okay? At the end of the day, protect yourself, regardless of anything.
I agree with everybody. I just think that it's just so easy nowadays to get tested and to get on medication and to start everything, if it's a preventative or just to keep everything, you know, stable. I think it's so easy to get resources now that why wouldn't you want to go get tested? That's just how I think.
So we are getting close to wrapping it up, so I'm going to ask some specific questions. So Angela, I would like to ask you, what impact has HIV had on transgender people of color?
It has had the highest impact on transgender people of color. It is more than 47% on transgender people of color. And it's rising. And it's because, you know, let me put it this way. Transgender women, especially transgender, they receive the highest level of stigma and discrimination. Okay, and I mean that's in the workplace, that's education, that's in law enforcement, that's your job, that's in the home. You know, and it's just very difficult. It's very sad, but it's true. So, you know, I mean, oh my goodness, what can you say? You know, it's life, and we have to find a way to deal with it. And I think that we were discussing a transgender support group at Tuesday. There has to be some way to get information to embrace these women. They need it. They need it, but we have to get them in. We have to get them informed, and we have to let them know that we care. That would mean a whole lot. And so we're getting there. We're getting there.
Lucinda, can you take PrEP with HRT?
Can I get a hell yeah? There is no contraindication for PrEP and HRT, I'm just telling you right now. Okay, you heard from me.
Roberto, how can HIV affect a person's mental health?
Do we have all night?
No.
No, okay. Well, if you think about it, just a diagnosis by itself can be a traumatic experience. Second, you're living with a stigmatized condition, which can affect you socially. It can affect you in a relational level. Aspects, for instance, disclosure can definitely affect the mental health of a person. Having to feeling compelled to disclose their HIV status. In line with that, the main aspect is more the social stigma than the diagnosis by itself. If you think about whether you're positive or negative, you're supposed to be responsible for your health. It shouldn't also be on the shoulders of the HIV positive person. I don't see a lot of literature on let's protect the positive. It's always in terms of let's protect the negative. The positive person is also at risk of gonorrhea and other STDs. There's at the risk of syphilis. That's carried by negative people. It is more than the mental health problem is not so much the HIV itself, as it is the social discrimination that comes with it.
And our last question, Dr. Davis, is PrEP. Can everyone have access to PrEP? Is it free? What if you don't have insurance?
So the great news is that PrEP is free. It is. There's no one, regardless of your insurance status or your financial status, that is not a barrier to getting on treatment. The makers of the drug for PrEP are very generous, and they have a very, very generous patient assistance program. You can make up to $75,000 a year and still qualify for the free patient assistance program. And there's no cap. There's no yearly cap. There's no lifetime cap. So you can be on PrEP forever, and you can get it for free as long as you're under the $75,000 annual income. But the good news is that really the same thing applies for if you end up being HIV positive. There are avenues to being able to get the medication if you don't have insurance or ability to pay. So you can get on patient assistance, you can get into the Ryan White program, so you never have to worry about continuous treatment if you, regardless of whether or not you have insurance. So either way, I mean, you are covered, and that's really the most beautiful thing.
With that, I want to thank Two-Spirit Health Services. Remember, you can check us out, twospirithealth.org. And remember, we are a center of excellence where we offer comprehensive health services for everyone in the community, the LGBT community, and those who support it. with that also miracle of love. Thank you. And we thank all of our panelists and everyone who was listening on Facebook. Thank you.